Antihistamines. There are different types of histamine receptors. For this class, I want you to know that there's the H1 and H2. H1 receptor is more responsible for allergic reactions, while H2 is mainly responsible to mediate acceleration of heart rate and also gastric secretions. So, what does histamine do? Normally, the function of histamine is during an allergic reaction, histamine is released and then binds to H1 receptors, right? That's for allergic reactions and cell mediated disorders. So, that's stimulated, then causes smooth muscle contraction, mainly in the lungs and stomach, and causes capillary dilation. So that increases the blood flow in that area. So that's what it normally does. Now, as a result, it causes bronchoconstriction, itching, upset stomach, red, watery eyes, runny nose, etc. Now, antihistamines, they basically block or prevent that reaction. So it does the opposite effect, right? Antihistamine block the effects of histamine. So it prevents that smooth muscle contraction and dilation. So it does the opposite. Now, the therapeutic effect of antihistamine include a decrease in secretion. So it can help with drying of the eyes, right? Nose, mouth, airway, mucous membrane, especially when it comes to like allergies. So it does have some anticholinergic effects. In addition, it decreases inflammation. So again, mainly in the eyes and airway, and some therapeutic effect, and it can also be considered as a side effect, is sedation. So indication for antihistamine is allergic responses and sleep disorders. Precaution on patients with liver or renal dysfunction, because as we know, it is metabolized in the liver, and when it comes to renal dysfunction, it can cause some urinary retention, which is an effect of the anticholinergic effect of antihistamine. Some contraindication, glaucoma. So, antihistamine can cause pupil dilation, which increases the risk for acute glaucoma attack. And then PUD or peptic ulcer disease. H2 antagonists are used for this. We have seizure disorder as another contraindication because it increases the risk for seizure depending on the active ingredient in the medication that we're using. And it's also contraindicated in pregnancy. So side effects, again, this can be interchangeable because sometimes the side effect is what we want for an effect. So it's determined by the desired or therapeutic effect. So side effect, if that's not what you're wanting to happen, right? Side effect, drying of the mucous membrane, such as dry eyes, dry nose, dry mouth, and sedation. Again, so this can be a side effect or it can also be a therapeutic effect because sometimes this medication, antihistamines, are used to help with as a sleeping aid, right? So depending on what's the purpose of this medication, then you can consider whether that's a therapeutic effect or a side effect. So sedation, drowsiness is quite common with antihistamines. It may make patients very reluctant in taking their medications due to these side effects. That being said, the second generation H1 antagonists do not cross the blood-brain barrier. Therefore, for the most part, unlike the first generation, it often not cause sedation or somnolence or drowsiness when they take the medication. So some nursing actions include monitoring for, again, therapeutic effects, side effects, also thickening of nasal secretions, right? Because it can be drying. And so sometimes the disadvantage to that is it's going to be difficult to release all those secretions. So it can get stuck in the nasal passages, which can be uncomfortable to patients. In addition, patient education, again, we're going to want to talk about the dosing. We want to make sure we talk about the sedative side effects, safety, and then combination of drugs, right? If we know that the patient is already on medications that can cause some drowsiness and they start taking antihistamines that can cause drowsiness, then that may be a safety concern. Examples of drugs in this class, we have Allegra or fexofenadine, we have Benadryl or diphenhydramine, We have chlorotrimethoprim or chlorpheniramine, Claritin or loratadine. And so Benadryl or diphenhydramine is going to be one that causes some drowsiness or sedation. So this is often used as a sleeping aid as well as an antihistamine for allergies, right? On the other hand, the Claritin or loratadine is considered a second generation H1 antagonist, and this medication is known as a medication for allergies that does not often cause sedation or drowsiness. And we also have Zyrtec or cetirizine. So these are the common medications that you see over the counter. So all of these are over the counter, but you just have to remember the ones with asterisk.